Hi, first of all, welcome everybody for this workshop. I'm delighted to have Matt Stefanelli as my co-faculty and all our young lot who wants to learn. And thank you very much for our patient who has willingly helped us to educate all of you. So it's wonderful. So now he is 90 kgs weight. He has history of steroid intake in the past, which has actually helped him develop some muscles. And I can see that he works out as well. So obviously he has some stubborn fat which he is not able to lose. Now as a result of steroid and some other nutritional intake that he had taken, he had multiple acne that has caused some keloid on his chest. So we need to be aware of that fact. Also he has a small umbilical hernia, which is very interesting because this hernia is different than, there are two kinds of umbilical hernia. One is because of visceral prolapse. And that's purely because of visceral volume. People who have a lot of viscera, in that case, usually the whole umbilicus is distorted. But this is a congenital defect. He has a small congenital defect that is causing that bulge without actually distorting the whole umbilicus. Now, we don't intend or plan to do any repair for him because it is asymptomatic. So we're going to basically do contouring for him and take away all of this subcutaneous fat. So let's start with the marking, and we're going to have a discussion because I want to learn from everybody and improve. So we can see the linea alba. Relax your tummy. It starts at the xiphisternum. This is the xiphisternum, and then the medial border of the rectus abdominis muscle. The medial border of the rectus abdominis muscle. The normal dimension of linea alba varies from 3 centimeter to 3.5 centimeter.
Which is more or less 2 fingers.
Correct.
You can do that.
Approximately 2 fingers. Yeah.
It's important because if you do just a line, it's not showing. So it's really wide if you want to have an intel.
Now also disadvantage of doing line is when they wear compression, they get a wrinkle there. Remember that? So we have to make sure that this doesn't happen. So for that, it should be a gradual groove, which would then ascend towards the rectus muscle. So that's our first marking. Then we will look for the lateral border of the rectus. Can you make it tight now? So when you make it tight, just palpate. And the best way to find that is at the anterior costal angle, which is the 9th rib. And this is where the muscle is attached, starts attaching. So you can find the lateral border of the rectus muscle here. And then from here, it goes to the pubic tubercle. So we just keep palpating. Sometimes you cannot palpate the lateral border in the lower abdomen because it is covered by fat here. But you can go towards the pubic tubercle. Now remember, it is not a straight rectus. Rectus is more triangular. Can you make it tight again? Same thing here. This is the 9th costal cartilage. And this is the lateral border of the rectus muscle. And we go towards the pubic tubercle. Now I'm going to mark the costal margin. This is the costal margin. This is the anterior costal angle, which is basically the 9th rib. And the rectus is then attached to the costal margin here. So this is where we'll have rectus attachment in this area. Now we will mark the linea semilunaris. A semilunaris again is a gradual transition between the rectus and the oblique muscle. So in semilunaris, we start first marking the subcostal depression, which is below this, which is like a triangle. So this is the subcostal depression. This is where we create a negative recess. Alright, and we will trace it down inferiorly. Now inferiorly, we palpate first, we mark the anterior superior iliac spine. Can you bend a little bit? Bend straight, other side, bend on the side. Yeah, so that's the anterior superior iliac spine and connected to the pubic tubercle. This is where the inguinal ligament is. That's right. Yeah. Now, I don't prefer to do exact straight linear semilunaris because it looks a bit artificial, yeah, particularly in men. In women, you can do that. But in men, we make two triangle. Right. Yeah. Now, again, in the upper part, this is the muscle attachment. So we will empty this part laterally. So the rectus muscle looks like a triangular structure.
So this zone, you are going to be quite aggressive in this.
Aggressive in this.
Here, you
Yeah.
keep a little bit more.
Correct.
Right?
Yeah. Yeah. All right. Now to mark the transcription. Usually one transcription has a fixed location. If you cannot feel the pulp, can you make it tight? So this is the first transcription actually, which is right on the costal margin. That needs to be kind of a low. Make it tight again. Okay, relax. All right, tight again. And then we look for the second. Second often is attached to the costal margin. In him, I can't feel it very well. This side maybe, have a feel on this side. Yeah,
Contract.
make it tight.
Here there is a muscle, and I think
so that's
here.
there. Yeah.
Here.
And likewise, yeah, relax.
It can be asymmetric, so
It can be a
it's
little
not
bit asymmetric, yes.
systematically here. It can be a little bit
Correct.
gone down.
Make it tight again. And it's again never a parallel line. It needs to be divergent. So I will at the end tell you how the shape of the rectus muscle is. Then the next intersection again, make it tight. Can you make it tight? Let's look if we can find any.
Here is
Yeah. Yeah.
often at the
There.
level.
Yeah. At the umbilicus or just above the umbilicus?
Contract. Yes. Muscle is here. Feel it here.
Right. Yeah.
Just above the belly button. It can be at the belly button, but very rarely, I think less than 5%, you find one below the belly button. There is no intersection in the six packs pattern.
Right? So now if you see, this is one muscle pack, and always blunt it here so it's round. Blunt it here also. Blunt it here. This. So this is one pack. Then this is the second pack. And then this is the fourth pack usually, which is one unit. The right one.
So here for this one, it's a little bit different left and right.
Yeah. So this will be a negative space.
Okay.
Actually, this will be a negative space. Yeah. Yeah. This one.
Wow.
This is on subcostal triangle. And this is the Adonis triangle actually, or Adonis belt.
It's a bit
All right. Now there's also sub-oblique groove, which is below the groove. So we mark the external oblique aponeuros muscles now. Can you bend? So this is first one. Again, the first one is often near the first transcription. This is the first belly. This is the second belly. And this is the big belly of the oblique. So in this we do negative spaces in between the bellies and in the sub-oblique space, which is here. Yeah?
Perfect.
Here. Bend again. See here. Yeah, well, this is the first one. I'm going to increase it. So this is enough. Now we mark the pectoral muscle. Let's mark the pectoral so it becomes easy to identify this. I'll make a chest tight. That's the lower border of the pectoralis. That's the lateral border. Same thing here, make it tight. Lower border. Yeah.
This, by the way, this areola is lower than the other. Show me.
Yeah, it was just a nice. Right.
So this is, we will empty here completely. Empty here completely. Now you can also see some asymmetries. There's less fat here, there's more fat here. So we have to take more fat from here. In a black pen. So this is to balance basically. Yeah. Go down now. Now this is to clean the axillary triangle. So that's the lateral border of the pectoralis major muscle. Now can you make it down like this? Yeah. You see this oblique muscle? The lat dorsi muscle. That's the lat dorsi muscle. So first negative space is just at the posterior border of the axilla to enhance this groove. And then you empty this to here. Almost like a triangle. Yeah, make it tight again. Down. This one.
Press me. And you know, because we have here this groove, which is basically like a kind of ligament, by being a little bit lower, I feel that we will be able maybe to release more.
Release the
Because if you're there, you're very close here, you have a bit more space. So I think it's not bad.
Yeah.
You want to make a little hole also at the base of the pelvis?
So just a tiny bit here, that will drain out. So we're going to remove this fat, remove this, to make the pubis a bit narrower. All right.
For the belly button, important the entry hole.
So the entry hole would be above that, I would also keep this standby to do lateral part.
Back. So
Then for pec we can do in the nipple.
here, just in the groove between.
Exactly. Perfect.
So if we count 1, 2, 3, 4, 5, 6, 7, and here 8 entry
Yeah.
hole.
And if required,
No, sorry, you do
10.
3, so 10.
stand.
10 because you have the belly button.
Yeah.
3.
All right, now can you turn around? You want to do this?
As you want.
Yeah.
So, but under your, because you are the captain, huh? I'm just the co-pilot. So basically, for the back, I like to personally avoid any entry hole in the middle of nowhere. So I start here with one hole in the intergluteal cleft, and here one between the arm and the back, like this. So with that, we can, with 30 or even 40 centimeter cannula, reach the whole back. Now we have important landmarks, the sacral dimples, which are here, which correspond to the sacroiliac joint. We have here also the midline. We check always if there is not a little scoliosis.
Yeah. There's a little curve.
There is a little curve here. Okay. And then here delimitate immediately a triangle. And here this line can be sometimes horizontal, sometimes a little bit forming a lacellation. It depends. It's at the end of the day, the end of the erectus spinae, the parallel vertebra. So usually from here to here, I don't go too aggressive in this zone to avoid, to erase this muscle. So we can go very strong here and then not so much here. And then if we need, of course, we can clean a little bit the midline. Here you see this triangle is having some fat. So we clean that, but these two bands, not so much. Then we connect with the front. So the iliac spine, show me, where did you put the iliac spine? Can you bend like this a little bit? I feel the iliac spine.
On the posterior, yeah. Sorry, like crest, yeah. That is the highest border than yeah.
Okay, so from this one, basically we connect with this one because this is the sacroiliac joint. So this is the iliac bone. We do the same here. Can you bend on this side? Yeah, okay. Halas, yeah. I feel it here. And I connect. So it's important because it delimitates what I called here the beak. What is beak is below iliac crest, which is basically the posterior love handles. Then it's all about delimiting where we are going to stop the lipo. In a male, it's, I would say, more easy because you don't have really to worry the transition between the waist and the hips.
Yeah.
In a female, it's really important. So here we can go a little bit more, aggressive. I like to raise the butt to see just the delimitation. Would you go here?
Yep.
Yeah? We agree on that?
Yeah.
Okay.
Yeah.
Just to clean nicely all these love handles. And by doing that, you see more or less the junction between the butt and the back. Okay. Here the same. So we have this delimitation. So this is going to make a big difference. By cleaning that, you are going to really make what we are looking for, the Adonis shape, which is basically a V shape. You can simulate it by doing that. We highlight the shoulder. Then regarding the back, from this hole, we are not going, we have here maybe I do it we have here the lat dorsi. So if you want, we can highlight a little bit. The lat dorsi has an insertion here on all this lumbosacral aponeurosis. So we can you push? No, can you push? Yes. So I feel here the lat dorsi, so we can highlight this border that was already marked in the front. And then we can go smooth here. We don't go to rhomboid.
Yeah, there's no need. He has got here. We just clear the infrascapular.
Yeah, exactly. So we do here and really, I would say, soft lipo from this hole. Yeah. And here again, can you turn a little bit? Now, can you push my hand? Yeah. Yeah, here I feel that. Perfect. This lat dorsi going up to the iliac crest, yes. So anterior border of the lat dorsi. And then here we need to mark the back rolls, because here this is like in the front, there is an attachment. It's like a retained ligament, so we need to release a little bit these back rolls. And then, yeah, like this. All right. Basically on the back, this is more or less the markings. Shall we do a little bit this?
Yes.
Okay. So from the same hole here between back and arm, we are going to just clean a little bit this posterior arm and to make at least, the definition between deltoid and triceps. So can you push? No, push like this. Yeah, you see here, he already has a good musculature. So this is basically the tip of the deltoid V. Maybe I do it in red. Keep it. So this is going to be a negative space. Like this. And here is the long triceps. Sometimes we can inject fat, but here we just clean here, and then we are going to basically clean all this. So simple. We could do more, but this is just. Let's do the same here. Can you push? Yeah. So we see very clearly this is the tip of the deltoid V. And then here. All right. Anything else? No?
Yeah, so I'll just mark.
Mark a bit more, actually.
So this will create a little negative, so it gives a nice muscular look at the back. Yeah, rest it.
Which is, by the way, very important in female, because we call it the sexy triangle, because by doing this triangle between here and the paravertebral iliac spine and here the back, it's really snatching the waist and highlighting the butt and the waist. Good?
Question? Anything?
Why do you test that for your mark posterior?
Yeah. That's the highest point of the iliac crest.
This is iliac crest, and in female, it's important because if you clean too much, then after you can have, a problem with the transition with the hip dips. So when I do here in a male, we clean completely. But in a female, I used to divide the zone in two. I put dotted lines here. In the upper part, I will go very aggressive because this is basically, just before the waist here. Do you see here the ribs? Here the crest. So the waist is here. This is, exactly. So you need to be very, very aggressive here in the waist, and then to make a transition. So here soft lipo, here aggressive lipo, and here soft lipo to make a gradient. Otherwise, I remember when I started a few years ago, I was too aggressive, and sometimes in the lower part, and sometimes I had a little step off between my fat grafting here and my too aggressive lipo here. It was a little bit aggressive. So to make a smooth transition, be conservative here in a female. Here we are in a male, so we can clean.
So in male, I prefer to do more aggressive here and less there to prevent feminization.
You mean what? You mean
No, here. So more here.
Yes.
More here and less here, so it doesn't go more sharp.
Okay. For the waist.
For the waist.
For the waist.
We don't have feminization.
Exactly. What we can do also sometimes, maybe it doesn't need here, but just because it's masculinizing, to do sometimes the lipo of the hip dips, because if you have this depression, it's actually highlighting the gluteus. You want to do it a little bit? No, it's okay. But you see here, just in these parts, we can also create a kind of hip dips.
Or you can also actually make a line from here to the tuberosity and clean it up laterally to the facial tuberosity, and then clean completely here. Here makes it look like a
V or like a V.
in the buttock. Yeah.
Can you contract your muscle?
Yeah.
Will you go here? You will here or here?
And even this one.
This one also here?
Yeah. For him, he doesn't need. I mean, he has a good muscle shape.
Perfect. So in the back, 1, 2, 3.
That's it.
Enough, huh?
Yeah.
Yes. Sometimes if you want to do this, you can also just use this one, but we don't, or for the inner thigh.
Turn around. Any more question about you? You okay? Yeah, Manju? All right.